Section 2. Materials and methods of holographic meridian scraping therapy. Instruments of holographic meridian scraping therapy include scraping plate and lubricators. These are buffalo horn scraping plates, having the functions of promoting the flow of qi, activating blood circulation to remove blood stasis, clearing away pathogenic heat, and removing toxic substances. This is a scraping plate made of jade. It can nourish brain to calm the mind, nourish in and remove pathogenic heat, strengthening the body and eliminating diseases. Professor Zhang Shouqing has designed specially this scraping plate with a concave part. The two corners of the scraping plate can be applied to holographic acupoints of the head and surrounding acupoints of the eye and concave part of the body. The concave part of the plate is suitable for scraping EXP acupoints and acupoints on the fingers. This is a scraping comb made of buffalo horn. This edge can be applied for scraping therapy, and the edge for scraping and pressing and dredging the meridians and acupoints on the head. It is better to apply the same plate or comb to the same patient at every treatment session. They should be cleaned with water or alcohol for disinfection and be stored in a special leather bag after drying. Lubricators used in scraping therapy are made from Chinese drugs and vegetable oil, with advantages of strong permeability and good lubricity. They can relieve inflammation and pain and protect the skin and prevent infection. Scraping therapy has specific techniques and manipulation methods. You should watch carefully to learn them in order to get a good result. Correct method for holding the plate is that grasp the plate with the palm on the bottom of the plate and the fingers on the sides. The posture of patients should be comfortable for them, with relaxation of muscles. Before scraping, lubricators should be smeared and scraped from the upper to the lower and from the middle part to the lateral sides. Do not scrap to and from. The scrapped skin areas about 1 inch in width and 4 to 5 inches in length, with the acupoint as the center. The width corresponds to the skin part of channels selected. Actually, the selected acupoints are covered, because the meridians are located at a certain depth. Only when the action reaches the deep tissues can its therapeutic function be brought into full play. The force should at least reach the subcutaneous tissues or muscles, and preferable to internal organs or the bones. Different constitutions and different conditions of disease need different degrees of pressure. Light pressure and slow speed, that is, reinforcing manipulation, should be applied to the aged or weak sufferers with chronic or serious diseases. And reducting manipulation, characterized by heavy pressure and fast speed, is often applied to young sufferers with strong bodies and acute diseases. Moderate pressure and moderate speed, called even reinforcing and reducting manipulation, is applied to normal people for health care or treatment of the patient with both deficient and excessive syndromes. However, reinforcing manipulation should usually be used at the beginning, then the pressing force is gradually increased. The reinforcing manipulation can also be used at the end of treatment. 7 kinds of scraping manipulations are introduced in the following. Board scraping. The plate should be in contact with the skin at an angle of 45 degrees, scraping in the same direction for many times. The manipulation is suitable for the even parts of the body. Corner scraping. The points are scraped from the upper to the lower, with the corner of the plate at an angle of 45 degrees to the skin. It is often applied at SI9 in the shoulder and LI1 and LI2 in the chest. Spot pressing. Points are pressed downwards at an angle of 90 degrees between the corner of the plate and the point. Increase pressure gradually and release suddenly. Repeat several times. It is suitable for soft tissues without bone protrusion or sunken parts such as GV26 and EXLE points. Tapping. Scraping lubricator must be used before tapping. The elbow joint of patients is supported by one hand and the 5 fingers of another hand holds together and the palm curves to tape meridians and points on the body surface. This is usually applied to the 4 limbs, especially in the foreseer of the elbow and knee. The trunk and neck are forbidden to scrap. This method can be used to treat pain or numbness in the limbs and disorders of the heart and lungs. Kneading. Points are kneaded gently with a circular movement at an angle of 20 degrees between the plate edge and the point. The plate should be in contact with the skin all the time to conduct the force into the subcutaneous tissue or muscles. This is often applied at tonic points for internal organs such as LI4, ST36, and PC6, and pain-sensitive points on the holographic acupoints of the second metacarpal bone and hands and feet, and the corresponding areas of vertebrae. Rigorous scraping. This involves rubbing back and forth or left and right for short distances, applying heavy pressure and with the edge of the plate at right angles to the skin, and the plate should be in contact with the skin all the time. This manipulation is a suitable maneuver for the holographic acupoints on the head. Meridian dragon scraping. The meridian is scraped with the long edge of the scraping plate along its direction with gentle and even force, from the lower to the upper or from the upper to the lower. Generally, scrap from the elbow joint or knee joint to the finger or toe tips respectively. It is commonly applied to the end of the therapeutic scraping or as a healthcare scraping maneuver to regulate meridians, relax muscles, and relieve fatigue. Points for attention. Avoid wind and keep warm during therapeutic scraping for preventing pathogenic wind and cold attacking the interior of the body. To treat only one disease at a time and limit the scraping time to no more than 30 minutes. If more acupoints are selected, they should be scrapped in groups at different times. Reduction manipulation are forbidden for the patient with weak constitution, and do not scrap a patient who has an empty stomach and overtightness. During scrapping treatment, the appearance of miliary cutaneous bleeding should not be overemphasized because it is influenced by various factors. Clinically, the appearance of miliary cutaneous bleeding is not completely in direct ratio to the therapeutic effect. Drink a cup of warm water after scraping can accelerate excretion of metabolites, and it is advisable to take a bath 3 hours after scraping. Do not scrap directly to the skin with lesions caused by acute inflammation with exudations and ulcers. Reinforcing manipulation should be applied to the patients with edema and varicose vein of the lower limbs, scraping from the distal to the proximal end. Explain scraping therapy to a new patient clearly for eliminating patient's worries. Scraping therapy is forbidden or be used with great care for the following conditions. Hemorrhagic tendency such as thrombocytopenia, leukemia, allergic purpura, and so on. And it is forbidden for the patients of serious hemorrhagic tendency.
出血倾向严重者禁刮。
Scraping is not suitable for the new fracture parts until they are healed. Scraping is forbidden for parts of the mass of unknown cause or malignant cancer, and for the patient after operation. Scraping may be applied carefully to the local part of the scar. Scraping should be carefully applied to the lower abdomen of women during menstruation and pregnancy.